day one conversation. I'm like, hey, if we're gonna do it on Zoom or Google Meets or whatever, it's not gonna work. No one's gonna download apps. Everyone has WhatsApp on their phone already.
If you see the matching that happens, it crosses the whole world. We have a pediatrician from New Jersey. You have a surgeon from Canada. You have someone from South Africa. Yeah. So you have patients in Gaza being matched with doctors internationally, Arabic-speaking doctors internationally, and this was beautiful. Just beautiful to see. All those children that had died under the rubble, not the unknown kids. The ex was there to represent them. We don't know who they are. We don't want to forget Tulin, you know. We don't want to forget Hind.
Assalamu alaikum. Welcome to another episode of the Prophetic Mentality Podcast. I'm your host, Amr Mabrouk, joined by my two esteemed guests, Dr. Haikal and Dr. Bakri. Assalamu alaikum.
Wa alaikum assalam.
So, guys, you guys are the founders of Gaza Health, one of the only platforms right now providing telehealth services for the citizens of Gaza. Please explain to me. October 7th happens, and in less than 2 weeks, you guys launched the Instagram page and you launched this organization or platform for doctors to start signing up. You guys do not have any NGO background. My understanding is, Dr. Haikal, you're still a resident.
Mm-hmm.
Aboud, you just graduated recently, right? So you guys are full-time doctors, essentially.
Yeah.
How did you guys do this?
SubhanAllah. So it was about 9 days after
9 days.
The siege in Gaza. 9 days. Yeah. We were just, everything that happened, everybody saw all the footages, all the videos that were going on in Gaza. Everything was clear. Humanitarian, the border was blocked for humanitarian aid. No doctors were coming in to help Gaza. All the organizations that Gaza relied on for medical aid were all stuck. And we realized that we have to think differently about how we're going to give aid to Gaza, to the patients that have chronic conditions, the patients that were displaced, the patients that don't need emergency care, but the ones that lost access to care, to their doctors, people that go from north to south, now they have to find their PCP. More than 50...
PCP,
primary care doctors. More than 50-60% of clinics were closed. Hospitals were getting bombed.
No meds.
No meds, no nothing. We realized that with low connectivity, we could possibly do something to help them. We wanted to help one patient from the ayah of the Quran. I was reviewing Surah Al-Ma'idah during those 9 days from my morning wird. Surah Al-Ma'idah ironically talks a lot about Bani Israel and the challenges of Prophet Musa alayhi salam. And one of the ayat that we all know, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. Whoever is able to save one soul, it's as if they've saved all of mankind. And the ayah, the verse right before is like, whoever kills a soul, it's as if they've killed all of mankind. And this was written ironically for the children of Israel, and it's also present in the Talmud. Mm-hmm. And so we knew we wanted to just do telehealth on one patient to be able to help them. We knew that we can at least do that. And I remember it was a DM. I DM'd Dr. Bakri. I told him, if you hear my voicemail, wallahi, this is how it happened. I went to Sababa Falafel, right? supporting my Palestinian local restaurants. And I came back and I was laying down and I couldn't sleep because of everything we saw. I just put my head down, laid down and opened my eyes and I said, we need to do telehealth for Gaza. I was super, super, super tired. I think it was 11 p.m. Mm-hmm. Went to my phone. I'm like, if you hear my voice, if you hear it, it's present. I'm like, you hear it. I'm like disoriented. Like, hey, Aboud, I think we need to do telehealth for Gaza. I don't know, dude. We just need to do something. And then Aboud starts, thinking about ways we can do it. He's like, if we do it, we have to do it through WhatsApp. And then, the very next day, we, send a doctor form. Yeah. Start recruiting doctors. We send a patient form and we try to recruit patients.
So you're doing this manually?
Manually, yeah.
You're manually assigning doctors to
at the first point, we mostly Abdullah and me chipping in, but we were trying to match people. Initially it was just me and him as seeing the patients, and then realized some of the patients were above our pay grade, so we had to loop in. Like sometimes we had pediatric patients. I have no pediatric training, and we needed help on that, cardiology cases, trauma cases, whatever it may be that we needed to assist with. So we needed to scale. But our idea was like, hey, we had seen the war in Ukraine. We saw what was going on with that. And people had done telehealth for them. And we looked around. None of the Palestinian organizations that we had known to be on the ground helping out in the medical system were establishing any kind of telehealth platform. I think everybody, the intuitive answer would be like, there's no need for that right now. Everyone's, being bombed and they have shrapnel wounds and they're missing legs. What are you going to do on telehealth? But the reality is, and now we got that confirmed when we saw Omar Sabha and Mohammed Sabha and all these guys come back. They're like, hey, there's still heart attacks, there's still diabetes and kidney disease and pneumonia and all the regular diseases still happen.
Exactly.
People don't stop having medical conditions because of the war. So we wanted to alleviate the medical system there that was already fragile to begin with. And we wanted to be a support to the primary care physicians, to the people that couldn't access their physicians, couldn't access pharmacy, and be kind of a guiding force there.
Yeah, that's actually something not a lot of people realize or think about. In an emergency situation like this, obviously the hospitals are going to prioritize the most urgent cases.
Absolutely.
Right? The people that are coming in the gurney, right? And even living here, you don't think about that. There's actually a whole other population, someone who has pre-existing conditions.
There's still car accidents.
People are getting hurt every day. Minor things. Someone still just needs to see their cardiologist. They need their heart medication. Right?
Exactly.
Like you said, they're diabetic. They need their insulin.
Right.
Exactly.
Whatever it is.
Or sometimes they just need a reassurance.
Yes.
Something happens to a patient. You just got to tell them this is normal. They don't have to go to the emergency department for example, in the first month, it was actually very hard to recruit patients. Very difficult. I mean, obviously, right? Because there's low connectivity. This is like new service and people don't know us, they don't trust us. Yeah. So when we released the forums, people were like, which organization is doing this? And me and Abud were like, we don't even have a name for this. Yeah. Right?
Us.
It's literally just us.
Guys, because it could be like some sort of IDF thing where they're trying to gather intel or information.
Exactly.
And the people on the ground there are trained to be suspicious of things.
Exactly.
To be smart.
Exactly. So the first patient actually was my friend's aunt's daughter.
Your friend's aunt's daughter.
Yeah.
Okay.
Yeah. Basically a little girl with an eye swelling. She signed up. The aunt signed up on this forum. This was like the first month, and we're like, wow, we got that one patient. That our mission was to help one patient.
Okay.
This was our opportunity to fulfill that, right? Because again, I want you to think about this. No doctor was at that point was able to come into Gaza and provide aid. Yeah. So to see that opportunity, like when that first patient signed up, it was like, I swear to God, I literally was in tears. Like I couldn't hold myself. So I reached out to the patient. She tells me through WhatsApp, because the connectivity is bad, so we couldn't really call or do video.
So you're doing voice notes.
We're doing voice notes or texts, and photos. So she sends me a photo of her daughter with her eyes swollen, basically. I gather like a little history. I actually called her, and at the time, alhamdulillah, there was connectivity. 3-4 minute conversation. Gave her a diagnosis, blepharitis, basically like a bacterial infection of the eyelid, and I gave her a recommendation. I said 1, 2, 3, and I sent it to her. And within
so it was on them to kind of go to the whatever's available pharmacy.
You don't need medication for that. You need
You don't need antibiotics?
It self-resolves. The next step is antibiotics. The first step is warm compresses. Like you massage the eye with like warm water for 10 minutes 3 times a day, and if it doesn't go away within like 5 weeks a day, I say reach to me again, and then we can talk to the pharmacies around which were functional. Yeah, there were actually pharmacies. That's something else that people didn't realize, that there are pharmacies that were functioning in Gaza still.
Okay,
right. And in the Middle East, you don't need a doctor's prescription to purchase medications. So we realized, we can just give him a recommendation and she can go and get the antibiotics if she needs to.
So that was resolved.
So 5 days later, I follow up with the patient. How's your daughter doing? Alhamdulillah, the swelling resolved.
SubhanAllah. So this is just you communicating via WhatsApp.
I just went down in sujood and I was just crying. I was like, because we realized at that moment that we can help people. We can help people in Gaza from outside.
Proof of concept. Because I mean, most people kind of doubted the idea. They're like, no, what are you guys doing? And this isn't the appropriate time for this. But,
Yeah.
But I think we had realized, I mean, in the first 2-3 weeks, we were just discussing like, hey, we know what's coming. Like I posted on, I think, Twitter or one of the platforms about, hey, what's coming to Gaza is going to be bad. Make dua, like donate to whatever organizations. This is before we started Gaza Health even. Everyone's like, what are you talking about? You're talking about this right now? Like nothing's happened yet. I'm like, well, things are about to happen. And I had been on the ground in May of that year, 2023, and in the West Bank with PCRF, Palestinian Children Relief Fund. We had done our medical mission. Half our group had went into Gaza, and they noted how the medical system there was already reliant on these foreign aid organizations, the WHO, PCRF, Doctors Without Borders, all these people. They are what kept the medical system going in Gaza. So when you cut that off, that life support off, we knew that there was going to be a massive medical disaster.
Emergency disaster.
I don't think I expected it to be this bad. 8 months later, that we're here and people are still not getting medications in now and all those things. But
exactly. Yeah.
So what goes into building something like this? Obviously, you guys had to learn something. You're building this from scratch. You don't have NGO experience. Who do you reach out to? What's the process? I mean, there's a lot of liability, right, that you guys are dealing with.
Yeah.
And it's all you're helping them over there, but also there is liability for you here. Of course, if you accidentally treat someone who's a designated terrorist, you get hit with material support.
Yeah.
At the same time, you're still a resident,
Of course. Yeah,
right?
yeah.
If your hospital is not
supportive of
Zaya Hospital, that's you on the line as well, right?
we played all these out. Like we did Murphy's Law. Like what can happen will happen. We went through every single possibility of like, what if this case happens? What if we get hit with this? What if this happens? What if they target our patients because of geo-tracking, whatever it may be, or they get spiteful and try to target us like personally, and who knows? Like we played it out, and I remember having this conversation early on with Abdullah. I'm like, hey, should we be very, very careful and not talk about this publicly? Or should we be radically transparent and just discuss everything so publicly that it's so clear what we're doing
clear.
that you can't hate on us?
Yeah.
Like I have ardent Zionist supporter followers on different platforms, and they'll still retweet Gaza Health stuff because they're like, you can't hate on Gaza Health. It's like we're literally getting meds into people that are starving. So
Exactly.
You can hate. You can be pro genocide, anti Gaza, but you can't hate what we're doing.
I mean, the genociders probably hate what you're doing.
They can't publicly say anything against what we're doing. Like it makes it's a strong man against them. Yeah,
I guess, yeah. I mean,
some people have souls
in their hearts. In their hearts, though.
Some people
in their hearts, souls,
they'll hate Allah you. But you know what I'm saying.
And we can't. The thing is, we as the Abu said, a lot of the really big organizations in the beginning, and this was actually very, very saddening for the both of us, were against the idea. So when we released the patient form and the doctor form to recruit doctors and patients, the doctor form I literally put it on a story.
Yeah.
Like usually stories, don't get much. They're kind of like beta tests. Like when I'm when we're recruiting, right? Like stories are beta. It's like not too solidified. It's not solidified enough to put it as a post. So I just did the story, and that story went viral. I'm telling you, like it was screenshotted and just sent all over the internet. And I saw it on like group chats. I hadn't been on in a while on humanitarian group chats, and I started getting responses. People are telling me, like someone responded to this. Abu would send me a response from like respectable figures that were like, this is a terrible idea. It's not the time for it. There's low connectivity. Telehealth is not efficient. But we have to understand that this is a completely different form of telehealth that we've never seen in our lives. What are we doing? We don't know. But all we know is we want to stand next to a patient that had completely lost access to any healthcare professional.
Why are they so against it? I don't understand.
They're so myopic on the trauma and those cases and the kids that are having their legs blown off.
Okay.
I mean, even then, there's some of them that we end up helping through antibiotics and what it may be for infections afterwards.
Exactly.
Like Dr. Jawad Khan that came back. He's like, hey, all these cases, had they gone on antibiotics a week before, I wouldn't have to chop off this kid's hand.
Exactly. And that's what we were doing.
Yes.
Like we were getting patients signing up.
So they're saying that this is the wrong time to
Focus on
you-
this.
Yeah, you're diverting resources to cases that are not urgent. Essentially, that's what it is.
But the thing we saw is that this
That's
was
their gripe.
very not very resource intensive. Like it all required is a couple of doctors and a little bit of their time and medications that already exist in Gaza, and just the doctor telling the patient to get this medication at this time.
Yeah.
So like the resources, like we could run Gaza Health and we ran it in the beginning with very minimal funding.
Yeah, I mean the startup cost first, I think 5 months was just the startup cost, $1,000, $2,000. That's
Yeah.
it. And we were giving consultations from outside. So now it's like we proved that we can get a patient or two.
Right.
Right.
Yeah, so you do that in the first few weeks.
We did that in first few weeks.
Yeah.
And then we recruited doctors, and we did this very quickly because this was like an urgent emergency situation. We recruited doctors, put them in communities on WhatsApp,
Yeah.
and we weren't getting any patients. And the doctors were like, "Why'd you guys put me in this group? Why aren't we doing any work? What's going on?" And we were like, "Just be prepared.
Yeah.
Just be ready
Yeah.
for it." And as Aboud said, like, this is for the long run.
Mm-hmm.
Like, we're not doing this. Like, this war might take a really, really long time, and the devastation that happened to Gaza is incredibly like beyond our imagination. And so, slowly but surely, we formed a partnership with the UNRWA, with the United Nations
What is that? United Nations
for Palestine.
Refugee Works Agency.
Refugee Works.
Yeah.
So there's a UN refugee agency for the whole world, and there's a specific UN agency just for the Palestinian diaspora.
Okay.
That happened after 1948, and there's political reasons why the Palestinians have their own little refugee agency. But a number of the people that live in Gaza are already refugees from other parts of Palestine. They were kicked out of their homes, driven out, and then they ended up in refugee camps within Gaza.
So once you guys get this partnership, I'm sure you get a lot more patients, right? Because you have that branding.
Yes.
That's like
Exactly.
these guys are legit. They're not out to get you.
3 a.m. meeting with the people in Egypt
Yeah,
and people
exactly.
in Gaza. We woke up to do that. I was skeptical. I was like, I don't know if they'll trust us.
Yeah.
But
You're just two doctors out of Orange County.
Yeah, yeah.
Like, they're-
Yeah,
we're
exactly.
like young guys that like we don't have the this big resume that
Who are these guys?
yeah.
Yeah.
We're the UNRWA. Who are these?
Yeah,
who are
yeah.
these two guys? But the thing is, the UNRWA was searching for it.
Yeah.
So they were looking for it.
They
Even though
said-
everyone here is saying this is a waste of time.
Yes.
They knew
did
they needed it.
during COVID, right? They knew
Yes.
they needed telehealth, but they're like, we just never thought about doing it on WhatsApp or on social
Yeah.
media. We relied on other things during COVID, but you're
Like
telling
that they
me
were trying to use those apps, like dedicated
Yeah.
apps, or those obviously those are very data.
That was a like day one conversation. I'm like, hey, if we're gonna do it on Zoom or Google Meets or whatever, it's not gonna work. No one's gonna download apps. Everyone has WhatsApp on their phone already.
and this was Aboud's idea. I said let's do telehealth. I don't know. I didn't have a plan. Aboud's like, we have to do it on WhatsApp.
Yeah.
And that was every patient in Gaza
Yeah.
had our app
Yeah.
for telehealth.
Exactly.
Nobody, does that make sense?
And then people were like, hey, that's a HIPAA violation. I'm like, listen, the HIPAA doesn't exist in Palestine. It doesn't exist in Gaza right now during a calamity. Like we have to do what we have to do.
Yeah, HIPAA's only
United States.
it's United States,
States,
right?
yeah.
It's not.
But what me and Abdullah were discussing, like everyone would come up with different like roadblocks. Like, no, you're violating privacy. You're violating this. Like, hey, listen, we're trying to get to these patients.
Yeah.
Are you coming with us or not?
Exactly.
That was like we were trying to push through. If there's a lake in front of you, are you gonna walk around it or swim through? We're like, hey, we're gonna swim through. We're gonna figure out how to get the doctors in touch with patients.
Exactly.
Okay.
Exactly.
So you guys build this platform. What besides the UNRWA partnership? What other partnerships you guys get?
So subhanAllah, like very early on, we meet up with a bunch of UCI students.
UCI
They
students.
volunteered to build us the first database.
Okay.
form.
Oh, these like software.
Yeah,
Okay.
software engineers. Like, funny story how Abdullah found them, but
Can you share or?
what ends up happening is Allah puts people in your way. Like when I explain this to other people, they're like, that is God's plan. Like Allah put things in our way. We're like, hey, we meet the right person connects us to the next person. And I remember after Jummah, me and Abdullah, we roll out to ECI. We meet up with a bunch of these kids. They're like excited, like, hey, we want to support you guys. Some of them are Muslim, some of them are not. And they build up the background interface, which I think is the beauty of Gaza Health is this first interface. The fact that we were able to get this so early on made it so streamlined moving forward.
Exactly.
Yeah, so I noticed you guys are calling it Gaza Health, not Gaza Telehealth. Have I been saying it wrong the whole time?
Actually, it was Gaza Telehealth the first week.
Okay.
GXZA Telehealth in the first week, but me and Aboud reassessed it because this was growing really fast and we didn't want eyes, to be honest, and we didn't want,
The wrong eyes.
the wrong eyes. Yeah, exactly. And so, look, we put the X there for multiple reasons.
GXZA.
GXZA for multiple reasons.
GXZA Health. Now that's what it is. Yeah.
Right. So every time I would post a story and I put Gaza, GAZA, it would get shut down. It would say you're violating community guidelines, blah blah blah. And everybody knew this. Everybody knew the culture of suppression on everything related to Gaza.
Right.
That's been so disappointing, right? That we had to change the name.
Yeah.
GXZA. The other part of it is like, all those children that had died under the rubble, not the unknown kids that were
Still
dead,
not identified.
or even the mothers, or just anybody that died and nobody knows about them, or the unnamed children that were born neonates and didn't survive because we all know what was happening in the NICUs. The X was there to represent them. We don't know who they are. So GXZA represents suppression of the social media content. Also represents oppression. It also represents dehumanization of the Palestinian population. And we realized that if we didn't do this, nobody was going to do it. Or nobody's going to give it the love that we wanted to give the people of Gaza. Because really, like, the whole world isn't with these oppressed people. And we wanted to build something that was like for them.
No.
And we don't want to forget. The issue with humanity, with the issue of Palestine, is that conflicts happen, tragedies and massacres happen, then we forget about them 2 weeks after a ceasefire.
Yeah.
And then it comes again and again. So in the name, we don't want to forget what happened. We don't want to forget Hind,
Right.
We don't want to forget Tulin, the girl that was under the rubble last week. We don't want to forget them, and we shouldn't. And so what happened was, in the beginning phases, we were just guiding patients to pharmacies, but we realized that there was a lot of essential missing medication in Gaza. And I remember there was one case in which kind of changed the way we thought about Gaza Health.
Okay, what's the case?
So we had a boy, 15-year-old boy,
The hemophilia guy?
with hemophilia.
Hemophilia.
What's hemophilia?
So clotting disorder. There's clotting factors you have in your blood. If you're missing one of them, your blood can't clot. So you get a small prick. 5 minutes later, me and you, we have a nice little scab over it and it's gone. These patients, they will bleed out.
So what are you supposed to do for them?
We need to replace these factors for them. So they get the medication through IV or whatever.
So no amount of pressure will stop them.
No, because they don't have the ability to make clots. So like these kids end up dying.
They can bleed to death.
Yeah, very easily. And there was a kid that was on the factor 9 medication.
He's on factor 9. Yeah.
There's 10 factors, and then one of those factors is factor 9. And then the kid didn't have his medication, no access to it. And then the magic happens there.
And then, so he was in Deir al-Balah at the time. It was a targeted area, but he was matched with an Egyptian physician. And mind you, that if you see the matching that happens, it's like it crosses the whole world. Yeah. We have physicians from literally a dentist from Kuwait that saw one of our patients, a pediatrician from Jersey,
A dentist.
a dentist from Kuwait, for like a tooth abscess.
Wow.
Yeah. You have a pediatrician from New Jersey. You have a surgeon from Canada. You have someone from South Africa.
Yeah.
So you have people, Jordan, you have patients in Gaza being matched with doctors internationally, Arabic-speaking doctors internationally, and this was beautiful, just beautiful to see. And so this patient in Deir al-Balah, the 15-year-old boy, was matched with an Egyptian hematologist.
In Egypt?
In Egypt.
Okay.
And this hematologist said this boy needs factor 9 or he's going to bleed to death. He was like on his bed. He needs this medication. So this physician took initiative. She reached out to like an NGO in Egypt, a well-known organization called Mersed, and they coordinated with UNRWA, which was our partner at that time. Now, they coordinated with them to bring the medication inside of Gaza. Okay, so now the medication's inside of Gaza. They coordinated with the Gaza Health team on the ground to take that medication from the border in Rafah and to hand deliver it to the door of this patient.
Yeah.
You guys are not just doing doctor matching
No.
and diagnosis. This is a huge logistical,
Incredibly incredible,
like
difficult
a
logistics.
huge logistical operation. Like,
But ask us how
you
we
know,
did it.
crossing
Yeah, yeah.
borders, last mile. Like you guys have.
Like he just mentioned that we have a team on the ground. We didn't even talk about that part.
Yeah,
Like,
I
it's
know.
subhanAllah,
We're all over right
I'm
now.
telling you,
but-
every step of we took, Allah put people in the path, and you know, it's not about me or Abdullah. It's about these people that are on the ground or on the triage team, the people that coordinate with the doctors. They are the gems. Like I don't know how we found them.
Yeah.
You know, Allah sends you the right people at the right
Yeah.
time. We have a guy on the ground, Haikal. He's, you know, above and beyond, phenomenal person. He's taking the meds and
Is
delivering
it okay to use his name or should we bleep that out? Let's just tell me now. So I
We
can,
kind of publicly talked about him, right?
Yeah, we've publicly radical
Okay,
transparent.
okay.
just making sure.
Yeah.
Yeah.
Okay.
can
For his safety.
Yeah, we
yeah,
can
that-
ask him.
that's what I was wondering.
I mean, he posts on his stories and we post on his.
Yeah.
Okay, then that's fine. That's
Yeah.
fine. That's fine. That's fine.
Yeah.
Okay.
So
Just making
yeah, this guy Haydar, he's you know a phenomenal gem. He's taking meds from pharmacies from the border, taking it up to different patients. And
So he's at the border getting the medication and then hand delivering it. He's driving
Yeah.
back, running
And
back, whatever he's doing.
Yeah. And now he has a team. He has doctors with him. A doctor, you know, Dr. Abdullah Nufal, that
Yeah.
goes with him and sees these patients, sees patients that need to be physically seen.
Yeah.
He has pharmacists with him to match. So we'll talk about it later. But
Yeah. So walk me through. You guys go from you know, two Google Docs, matching people manually, you know,
Yeah.
working and coming home, matching people manually, doing stuff on WhatsApp, to building the back end.
Yes.
Right.
Yeah.
You get people that build the back end for
Yes.
you, and then you're building an NGO.
Yeah.
Right. What's the next step? What happens?
We end up incorporating that in the NGO.
so yeah, we didn't know that we were gonna build an NGO. I had no intention, zero intention to do an NGO. Right? We just wanted to see one or two patients, get doctors that want to see patients, etc. But we realized that if we wanted to buy medications, if we wanted to do something legitimate, something that the world receives well, the patients in Gaza, you know, it's respectable.
Yeah.
We knew it was just natural that we had to turn it into an organization.
Yeah.
And so we did the legal Zoom. Within a few months, we become, you know, 501c3 organization. And I find out later that, you know, every time somebody asks me, did you get a lawyer to do this, the 501c3 and becoming a California NGO? I say, no. All we did was apply. We did our best, and we got it. And they're like, did you know you need like an official lawyer to walk you through these steps? And so me and Aboudi were just, you know, just clueless. We were just going in
Just
and
went on
doing
legal
stuff.
Zoom and how
And
to
doing-
NGO, how to 501c3, and just.
Yeah, and it went through.
I mean,
Alhamdulillah.
hey, how do you really need the lawyer if it got approved?
Yeah.
Every step of the way, we're just pushing through and trying to figure out what to do. And at this stage of the operation, Abdullah opens up the doors for Gaza Health with a lot of key contacts he comes in contact with. He's in Qatar. He's in talking to different NGOs here, Islamic organizations that are providing mentorship. They're providing guidance. They're providing input
Exactly.
to allow. Abdullah is I guess our spearheaded leader. He's the guy.
And
that's
Aboud's the thinker, the mind. He says no, yes.
So yeah, we got to give credit. Abdullah is the guy that
Alhamdulillah, yeah.
opened up a lot of things, and he was able to connect with the right people, and they were giving him input, advice,
SubhanAllah,
mentorship,
man.
all this.
Honestly, man,
What was one of the biggest like struggles getting it from two Google Sheets to what it is now? Like that transition, I'm sure, because while you're transitioning, you're still seeing patients,
right.
of course.
right? So are you building up a team? Are you
Oh,
getting
man,
funding?
dude.
Like what's
So we weren't thinking about funding the first few months. The first few months were actually very difficult because you can't, although we needed help, we needed manpower, you can't just bring anyone to an organization that's helping patients in Gaza that has data for the patients for Gaza.
yeah.
So it was very difficult to find the right people to trust to come into that circle. So we were doing most of the work, in the very beginning, like doing the matching process, while at work, like I would have my laptop open and patient signs up between patient cases. Then I would reach out to doctors or call them, be like, hey, can you see someone?
Yeah.
Very, very tedious. Now, Abu was doing the same. He was like, the backup doctor. If we couldn't find a doctor, he would see the patient. But slowly we found the right people,
Right.
that really made it into an organization. So we built the seeds, they built the tree, they watered it, they were everything that went into building this organization. And then suddenly we had, I remember I was taking a trip, I was flying out to Africa, and I'm like, who's gonna do the triage stuff? And then one of the doctors that was seeing a lot of patients, we realized that she was like, taking on a lot. She was always raising her hands, I'll do it. And sometimes that person that takes initiative is the leader of what you want to do. So I said, hey, I'm going on a flight, on a 12-hour flight. I won't be able to see any patients. Would you be able to do it? And then she's like, so you want me to do your job? I'm like, yes, please do my job. And so and then after that, this person just made an entire team. So I literally, we were getting like maybe 1 or 2 patients a day. I step foot into the airplane, I land, and now we have 30 patients suddenly.
Yeah.
A day.
So what ends up happening is the UCI team that they had to help us build the back end.
The back end, yeah.
What happens was there's a ledger that has all the patients, and the moment a patient signs up with the Google form, it goes onto the ledger, and then an email goes out to all the designated people. Hey, there's a new patient. Right.
Oh, so the system automatically assigns.
Yes. It automatically says that there's a patient.
Oh, okay.
It tells us.
Yes.
It tells we have there's like a team like PA and Ps, new like med student grads, residents that get pinged. They're on call basically.
They're on call. Okay.
Yeah. At first it was just us getting it, and then we're like, at this time when Abdullah goes to Africa, we decided, hey, we need to have a triage team, and that's what made Gaza Health actually flow nicely. Is that there was this team of people that Abdullah had mentioned.
Can we just explain what a triage is?
Yeah.
I understand it, but for the listeners.
Yeah, good question. Triage is like in the hospital, if you come in and you're in the emergency room, there's people that have heart attacks and will die in 5 minutes, and there's someone that has a toothache and can be seen in a few hours. So someone has to be up there triaging, deciding who gets seen first, who goes where.
So like you come in, you see that triage nurse, right?
Yes.
And then you talk to them.
Yes.
And then they tell you, okay. And then you go back out, and sometimes you wait a long time.
Yes.
And sometimes you go in right away.
Yeah.
So they're the ones who decide like the priority.
Yeah. You come in, you say, hey, my face is drooping. You look like you're having a stroke. They don't talk to you anymore. They put you on a bed and they get you inside. You're having a stroke. But if you're like, hey, my tooth hurts. How long has it been hurting? 4 months. They're not gonna care about you. But
Got it.
the way the ER works. But yeah.
So you get a whole triage team.
Yes.
Okay.
Yes.
Great. Before it was just you.
Before it was just me,
Or
me,
you
Abu,
two, okay.
us 3, and then 1 or 2 other volunteers that we were like, please, we just need your help.
Yeah.
But then after that, after I went to Africa, I'm telling you, it's Allah subhanahu wa ta'ala, man. Like these things that are like very hard, logistically hard, building a team, making people motivated. We never did that. We never told people to do this or it was never an issue to motivate volunteers, So suddenly they're just doing it. They're just doing the triage thing, and doctors are taking patients like within a few minutes. Yeah. You have a patient signs up within 10, 20 minutes. They're matched at the time.
So the triage team gets the ping, and whoever is assigned goes on the ledger. They designate themselves like, hey, I'm Ahmed so and so. I'm gonna match this patient, and they go into the WhatsApp group chat. That's like, hey, this is the internal medicine team. This is the family medicine team. This is whatever, and they'd be like, hey, there's a new patient. This is the case. Who can take it?
Exactly.
And then one of the doctors will take it. That same triage member will designate who the doctor is, and then if there's any kind of follow up that's needed or a prescription form that's needed, whatever it was, that was coordinated, and then they would.
So they put them in like a group chat or something, and then
the doctor would reach out to the patient, and then they would be like, "Hey, the patient needs this medication," and they set up the prescription, and then we get that prescription over to.
So part of our partnership with the UNRWA, part of our MOU is that on our prescription form we have their logo on it.
Yeah.
And our patients take that prescription. They go to the UNRWA, health centers. There were 8 functional ones. They go to the centers and they get the medications for free. They don't even have to be seen by the doctors. The UNRWA gives us the list of medications that they have available. and our doctors have access to that.
Yeah.
So they're prescribing based off of that.
And this is key because everyone that said that telehealth wasn't the right time, imagine if those people were waiting in line at that UNRWA health center, they're taking away resources from everyone else there.
Because there's probably only a few doctors there.
Exactly. So now we were able to offload that center and help streamline the process of patients getting seen.
Yeah, now those physicians can be dealing with like more emergent cases.
Exactly.
On the ground.
And on top of that, part of our agreement was also that Gaza Health does these in-kind donations. So every few months, we help resupply the UNRWA stock. So how does that work?
How does that work?
How does that?
How does that work? How you have to get medications into.
So we have to get
into Gaza.
medications into Gaza.
Yes.
Okay. And that was a logistical nightmare.
1 second.
Yeah.
Before you start. So the UNRWA happens when? This is like January?
No, earlier.
Happens pretty early.
Oh, okay.
December.
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 Yeah.
Okay.
But it becomes official later. First they were, I think, just kind of testing the waters.
This is before the UNRWA gets defunded.
Before, yeah.
The UNRWA getting defunded was very challenging for us because we lost one of our main funders, main partners that had the funds to get the medications and stuff.
Mm-hmm.
Okay.
We didn't lose them, rather. We they were struggling.
Yeah.
There's a lot of different moving pieces to the story. So
that's a lot. I mean, 7 months.
It's been 7 months, but I feel like it's been it's been a roller coaster.
Yeah.
It is.
Okay, so UNRWA was defunded. Who else are you working with to get medications in?
So initially, we had to figure it out.
You had to figure it out.
Yeah.
At some point, you go to Egypt yourself.
Yes. So I go to Egypt with.
When was this?
This was around I think late February.
Late February.
Okay.
Yeah.
Okay.
Late February, like before or during Ramadan. Yani right before Ramadan.
Right
started.
before Ramadan.
Yeah.
So at this point, you guys have the back end set up. You have the triage team. You're on the move, right? You're making moves, right? Everything's going well.
And at this point, we were only able to enter one medication into Gaza.
Yeah.
By the way,
it was just that first,
just
the factor 9.
Yeah.
Exactly.
Everything else has been through
What's
UNRWA and then
there.
what's already
inside.
there.
Inside.
And what
exactly.
other pharmacies that are able to supplement.
Exactly.
Okay. So you go to Egypt.
So around this time, we were now in the phase of we need to get stuff in.
Mm-hmm.
Okay.
Right. So the UNRWA was like, we can help you guys bring stuff in into Gaza, right? Medications. And so I take a few backpacks and I go to. And
yeah, like few suitcases.
A few suitcases, probably 3 or 4.
Yeah.
And people I had sent a message asking for people to donate medications. Just any medication you guys have, please donate them. And specific ones that we needed for our patients. So literally the morning before traveling, someone drops off like 300-400 medications, man, outside of my porch. And I remember like an hour before leaving the airport, I walk outside and I see like literally my bench filled with like medications. And I'm like, I have to look through all of these, man.
Yeah.
Because if there's illegal stuff in there, I'm going to get in big trouble when I get to Egypt. So I literally had to look at every single medication. I found, some narcotics. Found like 8
scheduled substances.
Yeah, like
you can't travel with those sometimes.
No.
Yeah, man. Like Norco and all that. And I had to oxycodone, so I had to throw these out. Well, the way you do it, you have to put it in the sink. And
You disposed of it.
I disposed of it. Just
yes.
disposed of it. And I get to, so I make it through LA with no issues. Make it through Istanbul without issues. Now I'm at the door to leave Cairo. To leave the Cairo airport.
Yeah.
I made it that far. And I can feel the breeze of Cairo, the heat, and I can see the trees and the wind. I'm like, wow, I made it this far. And then suddenly they're like, tal. Eda, what do you have in there? What do you have in your backpack?
Yeah.
I say, I'm a doctor. I'm just bringing in medications for something humanitarian. They're like,
do you have paperwork, man? Like
bro, I'm telling you,
you went into Egypt with 4 bags or 5 bags of full medication. No permits, not even like a connection. Like Oh my
Absolutely
God.
nothing, man. Just a connection with the Almighty, brother.
Subhanallah.
I'm telling you, when we said we were steamrolling through whatever we could, like, hey, this is a problem. We're gonna figure it out.
So, person opens it up. ما كان مصلى على النبي at the time. He was like, "Hey, Dad, what are you doing?" And then he's like looking at the medications one by one. He's putting, and then he opens. He sees a medication, and there's a red, red sticker on top of it. I'm like, oh shoot! All the ones I threw away back home had red stickers, and they were like opioids. And then he looks at it, and he's like, "Oxycodone da?" He's like, bro, ما فيك تهربوا. You cannot bring this in. What are you doing? This is illegal, you know? And then he just calls his friends. He calls the security, and everybody now is like cuddling, looking at this stuff. And they're like, who the heck is this guy? What are you doing with all these bags and meds? And it was a nightmare. It was a nightmare. And then they're like, come to the back, you know? Oh man. So I go to the back.
How many hours were you?
It was actually, alhamdulillah, by the grace of God, it wasn't too long. Okay. It was like maybe 2 hours. Yeah. I was just keeping my calm. And then I arrived there. I don't know if I told you this, and then he says, where's the oxycodone? I can't find it. Did you take it? He's telling me that. I'm like, no, wallahi, I didn't take it. He's like, you took it because I can't find it. Where is it? You know? And then he tells his friends, he's like, he hid the oxycodone. He took it.
One of them probably took it.
Bro, I'm telling you, I'm like, wallah al-azim, I didn't take it. And I started looking at the meds. I couldn't find it. And then, eventually we found it. And the guy was like, just like, what are you doing? He was just telling me constantly, like, this is insane. And then I say, man, look, honestly, people told me not to do this. But I say, look, I'm a doctor from the US. I am bringing these medications in for specific people in Gaza. Please just, you know, you can throw them away and let me go through, or you can, you know, help me bring these medications for the people of Gaza. It's that simple. And one of them thought I was like literally building a pharmacy in Egypt. So with the grace of God, man, he let me go. And
the thing is, it's like at that point, it's a personality, people's thing, like because it's literally up to them.
Yeah.
You know.
Yeah.
So they let you through.
They let me through, and I had brought iPads with me. I had like 3 iPads. This was unheard of at this point.
They let the iPads in?
3 iPads. I had blood pressure cuffs, and I had a modem, like a eSIM modem that would power like 20, 30 like phones in Gaza. And he's just like, you have to give me a dariba for this, like tax for this, you know. And I just gave him a dariba, $120.
The modem, bro.
Dariba.
Yeah.
Bro.
The thing is, people don't understand, if you've never traveled to Egypt, they can be very finicky with what can come in the country.
Yeah.
Like if you come in with like a camera and it has a mic on it, they'll take the mic from you.
Yeah.
If they see your drone, they'll confiscate it. If you have a camera lens that's like a little bit long, they'll be like, no, you can't take that.
You're spying on somebody.
You're spying, exactly. Like, so.
But I said, what's there to lose? Like, worst case scenario, they don't let it in. I lose
that is
a few $1,000.
Subhanallah, yani. What is there to lose, Habibi? And you can. It's Egypt, yani.
It's Egypt.
Like I say,
no. For me, it could have gone. I mean, the thing, to be completely honest, it could have gone sour for you.
Absolutely, man. Absolutely.
Yeah, like if you were, you know, with the wrong.
Of course.
I'm Egyptian, so like, if you get, you know, caught up with the wrong official, it could have gone sour. You know, so it's alhamdulillah that you're able to get in.
Bro, I use my Lebanese accent. I know you guys like Lebanese, man. Do we? I don't. ناسي أقرب أنا مصري يا حبيبي. And I was talking in my Beiruti accent, man. أنا دكتور من أمريكا يعني ما في مشكلة بس أنا بدي أساعد. You can, man. You just have to know the game, man. I know you guys have a soft spot for Lebanese people.
We have a soft spot for Gaza.
Yeah,
alhamdulillah.
That's what won them over.
Man.
You know, I'm sure once they calm the situation down, they realize you're serious. Like, okay, we're gonna let them through.
Yeah, man. So
you know,
so they took the oxycodone.
No, they let me. They put it in my bag.
Oh wow.
They let it go. Yeah.
That's
yeah, man.
They really trusted you then.
Alhamdulillah worked out. That's crazy.
So I actually saw on your Instagram when you were in Egypt, you were like seeing patients in Masr, or what was the?
So, oh man, that's a different man.
Is that not Gaza Health?
It's not Gaza Health, but it is. Everything is Gaza Health. Like every time we see a patient, that's the thing. From Gaza, you connect them with a doctor. It's Gaza Health. So we visited families in Egypt that came from Gaza. And most of them were women, without their kids, without their husbands, because the husbands are not allowed to come in. And it's the saddest stuff, man. Wallah, if you just sit with them.
Can you tell us some stories?
Allah, ya Allah. Like I remember going into this patient's home that basically had lost, like had retinal, like a retinal detachment, and had to do retinal surgery. So they brought her to Egypt. She had a 7-month-old baby
Yeah.
in Gaza that she was still suckling, that she had to leave behind. Yeah.
Why?
They didn't let her bring the baby. They didn't let her bring the child.
Or it's cost prohibitive. You got to pay for each person to get out. So if you only afford one person out, you can only afford one person out.
So she comes solo. Her husband was, stitch head the babies with, with her aunt, and the mom's like alone in Cairo. And she was telling us stories of people trying to take advantage of her. Like, because she's going home to home, relying on just people of khair. Sometimes the people of khair
Are not
the people of khair. They don't have the best intentions, or they're sickos. And she was telling me, like, just bad stories, man. Like, this is stuff people don't talk about. But
yeah, every humanitarian crisis, there's people that are trained to take advantage of these things.
you have a 24-year-old woman that lost her husband, that doesn't have, a source of income. Super vulnerable, right? Let's just say,
Yeah. No, I understand what you're saying. And unfortunately, there are these hyenas.
Yeah, and
And I don't even know what to say. Like, there's nothing you can do for these people except pray.
yeah,
Allah's with them.
Yeah.
And, may Allah empower the men in the area to kind of
Yeah.
help, because that's what it is. You're in a country without your support.
exactly. And you do your best to link them with support, with
Trustworthy.
Like, yeah, and yeah, dude. The other story, they're sad. Like a woman left 3 of her kids, and she was just showing me photos of them, and they're stuck. Man, the story of this baby. The woman's telling me her child, that she, her child was martyred. From an explosion. Basically, her child died after an explosion, and child was like under a year old. And you know what she said? She said, if I knew he was going to die at that moment, I would have bought him nicer clothes to die with. Wallahi, she had all of us in tears, man. All of us in tears. Ya Allah, Ya Allah. These are the stories. It's stories of separating families, of dismantling families. This is what it is. Why would you leave a 7-month-old child back home? Why don't you bring with their mom? It's simple, but it's that's what they're trying to do: separate people, build psychological issues, not provide medical care, not provide health. This is the genocide.
And don't forget, there's October 6th. There's already a bunch of people in Gaza that are missing their legs, missing their arms. People that have PTSD from 2007 and 2014 and 2021. Like all these people, they're hearing these bombings again, and they're just triggering whatever already was underlying from before. And
Is part of Gaza Health at all providing psych services, counseling?
Yeah.
I mean, is that even a
We
possibility?
do.
that
We
you can.
through text messages. You have a human being. So this was the story. One of our counselors said, "What am I doing? Like helping? I'm here in Dubai, and I'm trying to do counseling for a patient in Gaza." And she told the patient, she's like, "I'm sorry, I can't. I'm not able. I don't feel like I'm being helpful to you." You know what the patient said? She's like, "Trust me, I would rather, it's either I'm home and there is a tank and basically soldiers outside my house, and I'm alone, or you're next to me while that's happening.
Yeah.
And that means the world to me. And so that's what we're doing with support. We're not doing therapy. It's not therapy. It's
Pure support.
we never called it therapy. It's always pure support, friend support, supporting the supporters. We're here next to you. We're next to you. Even if we can't provide medical aid, we just want you to know that we care, that you are humans, that we care about you, and we're doing our best. We're next to you.
Now, the tough part there is that some of our own providers ended up having something close to PTSD from seeing so many things on the ground in Gaza. It was traumatizing our own people, especially when they weren't able to get certain medications or weren't able to because like there's certain medical cases where like, hey, flip of a switch here in California, you can go get something and treat the patient.
Yeah, man.
When you can't get that, it's almost more traumatizing.
Like children without insulin.
Yeah.
The child is constantly, hyperglycemic, and they're gonna die from, DKA.
Yeah, here it's just like
Yeah, easy.
easy fix.
I want that to come to the message to be sent clearly. A child not having insulin.
Yeah.
And
easily fixable for $3.
not very, very fixable, right? This is completely unacceptable. It should never happen.
So was this some of the emergent medication that you brought with you to Egypt?
We were trying. I couldn't bring insulin, unfortunately.
Okay.
And it was really hard, man. At that time, it was really stressful when the doctors were breaking down. We had patients having seizures, and they needed Keppra. They needed their anti-seizure medication. I'm sorry, like
there's just stuff we take for granted here. That's just available. So you go to
super
any
easy.
ER and
super easy.
And the other thing is what they're used to doing there is like a very extreme triage medicine, where if a patient comes in here and we know he's probably going to die, we still try to resuscitate him. We give him 20, 30 minutes, sometimes an hour, trying to do things.
Yeah.
If he comes into Gaza now, I was listening to one of the doctors from Fajr Scientific on our friend Piers Morgan, and they were talking about like, hey, a patient will come in, and if he looks like a dead case, they just say, hey, we're not going to even touch this patient.
they don't have the time.
Because like, hey, no, those resources that we will use futilely, 99.9% on this patient, we will save them for somebody else where we can help them. So it's a different medicine completely. Like the closest thing here would be COVID times, but nothing close to what's happening now in Gaza.
Yeah, Latif.
Yeah, Latif. Yeah. So I get to Cairo. I meet in person with. I go to the World Health Organization building. I meet with the UNRWA staff. I deliver the meds. We have like a nice meeting, and they send everything inside. That was kind of the first time we realized and the way. So previous to that, we were buying meds.
I have a question. Why couldn't you just go to Egypt and buy the meds?
Oh, that's we learned the hard way.
That's
Here
coming now.
Here's where
What's going on?
here's where we learned our lesson.
There's a
right?
lot of
I learned my lesson.
I
I learned my lesson. Like, don't bring meds from the States to Egypt.
Okay.
All right. There's a lot of saydaliyas in Egypt, right?
Pharmacies.
A lot of pharmacies in Egypt.
Yeah.
And so what we realized that we were buying medications. We were buying formula for kids all before I went to Egypt, but they were stuck. They were stuck in trucks, right? So our mentality was we have to bring them in through aid organizations, through big trucks. When I got to Cairo, we realized that there were convoys that were bringing material in, people going into medical missions that were bringing medications in.
Yeah.
And
you can't just leave it on the truck. It might get stuck.
No, and the trucks don't like
sometimes the trucks get robbed. Like you
our
can't.
friend Ahmed, he showed us a video for miles and miles from the Rafah border on the Egyptian side to the Gazan side, just trucks lined up. They're just there, stuck.
Yeah. But with the convoys, the medical missions, they bring them in, right?
You could just go with a person.
They just go and they deliver it.
And I remember Abdullah calling me a week before he went to Egypt. He's like, hey, Abu, do you think I should go? Is it worthwhile? I don't know if I'm going to be able to do much. I'm like, hey, if you can just go on the ground and establish ourselves and meet the right people and get the right connections, it will be worthwhile.
Bro, that realization, just the fact that we can't rely on orgs, we have to rely on individuals coming into Gaza, completely changed everything. So...
Sorry, can you explain that to me? I thought you meant with these organizations, they're sending people in, right?
Yes. But then finding specific doctors...
So the aid organizations with the trucks, with the aid coming in, the big humanitarian aid that we thought was kind of the only way of bringing stuff into Gaza. So what we started doing was we started purchasing medications from Egypt, and every time there's a convoy coming in, we would basically,
out.
and our pharmacist in Egypt would deliver a suitcase of those medications for our patients to that person's hotel or whatever, and they would just bring it inside and deliver it to Haidar. Haidar would sit down with a team of pharmacists and call the patients.
Take him and triage it and send it out.
Dude, there were stories that Haidar was
good.
going to in the hospitals delivering insulin to patients inside of hospitals.
And mind you, this guy is like an engineer. Like he had a thriving career before this, and then here he is now delivering medications for Gaza.
So you guys are in contact with pharmacies in Egypt.
We have a supply chain team.
This is,
in
yeah,
Egypt.
that's what I'm saying. You had to establish. That's what I'm trying to get at.
Yeah.
You had to establish a supply chain.
Yeah.
Between Egypt and Gaza, and you're most people would like have to go hire consultants. And,
Bro,
but you literally just went on the ground. So you go from you're in contact with a pharmacist. You buy the medication. You pay them however way. They hand deliver it to a contact that you've established, through a humanitarian organization. This individual person is going in, not on a truck.
Yes.
exactly.
They get
That we
this.
trust. We know that they're
We know them.
reputable.
Yeah.
They take it across the border.
Yes.
Hand deliver it to Haidar.
Yeah.
And he's like, okay. And then they open it up, do the intake. This is what we have. And then they distribute it.
They distribute it. Exactly.
Yeah.
Exactly. And I'm telling you that the people behind this are incredible individuals. Like our supply chain coordinator, genius, man. Like, how can you, coordinate like the logistics of this and all that? The pharmacy, our pharmacy team, incredible. Like, aligning the patients with, that we purchased the medications with, and the delivery that we had to do, the intake, the inventory, the triage team, the doctors, man. It's just
Levels of it.
yeah, man. With very little control, with very little, you guys have to do this, you have to do that. People know what to do. It's very straightforward. But
And that's why we emphasize, I think, decentralized command is like me and Abdullah had this conversation many times, that in order for us to succeed as an organization, we have to find these key leaders, and they usually present themselves by the
exactly.
grace of Allah.
So me and Aboud, what our biggest struggle is, how can we make this into a 20, 30 year organization without it getting like destroyed, so we have decentralized command, but we also have to think very carefully with legal and like teach the team like what we learned from legal. So we sat on a table with MLFA, Muslim Legal Fund of America. We spoke to CARE. What are the things? What are the worst case scenarios? We asked. So the question was, how can we prevent material support?
How do we get our doctors not getting sued for malpractice? And some of our doctors were asking, like, hey, am I covered? Am I liable? Do I have insurance? You come from an American mindset. Everything here is like, hey, if a doctor looks at you wrong, you can sue them for being mean. Or
Yeah, definitely.
But this is kind of also, we go back to the radical transparency. Yeah. So this is why we have to be very, very careful with our words. So last May, we purchased medications for 400 patients, cost us $10,000. Okay. Now, if you word it, if you say, $10,000 worth of medications are now being distributed to patients in Gaza. If you say it like that, you might get in trouble.
$10,000 worth of medication.
What did you do? Did you bring in 10,000 and did you buy the medications inside of Gaza through those 10,000?
Yeah.
Or what exactly? Yeah. We don't want any of those questions being asked. We want to be very clear.
We purchased 10,000.
We purchased medications from Cairo, from our pharmacist in Cairo for $10,000, and they were brought in by this humanitarian organization into Gaza, and they were, delivered by our, ground.
So you're posting like proofs on Instagram or social media.
Yeah, we have a social media team.
We're not allowed to do many things.
Yeah.
We're not allowed to bring money to Gaza. We don't mess with that.
Yeah.
We don't ever mess with that. It's a big struggle. So,
how do you deal with like treating someone who may be on a list or something? Do you have to?
So
did you have to put protocols?
This is
for
why
that?
we have to. Yeah, we put protocols. We actually have to background check everyone.
Yeah.
And what does that entail?
There's an online website you have to check.
It's a sanctions list.
Yeah.
Just type their name in.
The U.S. sanctions list. You have to type their name in variations.
Yes.
And we have to do that to everyone because
our doctors as well. We have to make
Our
sure our
doctors
doctors
as
are,
well.
are legit.
Because unfortunately, the rules of treat if you see someone in trouble and you treating them, the rules don't apply to people of Gaza as they do to the rest of the world. You can't just treat the people of Gaza.
Yeah, because in other conflicts, if you're treating a wounded soldier, it's okay,
Yeah.
right? But if that soldier is demarcated as a terrorist,
Yes.
then you are liable.
trouble.
So that's the
Yeah.
the situation.
And regardless, the de facto situation on the ground is that these people are not even reaching out to anything. They have their own system. Like one of our friends is on the ground now. He's like, none of these people will end up to the hospital because they don't want to put the hospital in danger.
Yeah.
So like when one of their people get wounded on the ground, they don't come into the hospital because they know, like, if I come to the hospital's going to get attacked. So the whole story about human shields and blah blah blah. It's farce.
We know that's that's BS. Yeah,
so
Hamas was occupying the hospital.
Yeah.
Like no.
So they're smart enough not to reach out to and put their names out there on a Google form. To the world.
No, obviously it's there's that happening, but
Yeah.
I'm just saying. I was just making the point that
Yeah.
know on this side you do have to still be careful
Absolutely.
because there's
And-
evil people out there.
Yeah. And to clarify, we don't do any of that kind of stuff. We treat people, the innocent civilians that don't have any affiliation with any organizations or parties.
We
or
make
groups.
sure like
I
our
understand.
patients know that we're not you have to be clear with us if you're part of any organization. Do you have any of those
Affiliations.
intents? We can't treat you.
We can't treat you.
No, I
Because
mean,
we
and
can't
that
have one person ruin it for everybody else that we're treating.
and so in that regard, we're very careful. But none of these patients are.
Yeah.
Yeah, they're
They're not.
They're civilians.
They're
all
civilians.
Yeah.
Um,
No, but these are the kinds of things that you have to think about when you put an organization like this together, because it's very murky. You don't always know what's happening, right? It's a very especially the logistics. It's all people. It's all relationships, right? I don't think you can have anything but a decentralized command.
I mean, if we talk about prophetic mentality, I mean, the one of the greatest things the Prophet Muhammad Sallallahu Alaihi Wasallam left behind is that he left behind leadership. He left behind people, a network of people. There's probably 500, 600 people that the day he died, they could have taken command and they would have done a phenomenal job. And they led all these different organizations and military campaigns and dawah campaigns, whatever it may be. That's, if you want to study the miracles of the Prophet Muhammad Sallallahu Alaihi Wasallam, that's the miracle of what he was able to build in terms of people. And that's what we want to build in our organization. We want these people that fear Allah, that love Allah, that love the people of Gaza and want to support the people of Gaza. And they're showing that they're sacrificing all their free time to be there and provide whatever they can.
Yeah, and I think you mentioned a few people now at this point that kind of you mentioned Haidar. You mentioned the female doctor. You don't have to mention her name if you don't want to. She became the triage nurse, right? So you have people in Egypt,
Supply chain.
team, supply chain, all these people that just kind of through the
legal,
process, they just show themselves like these.
Legal, HR, software,
Yes.
social media team,
the UCI team,
the marketing, the branding. Me Abu didn't want to be out there, but the social media team came and said, "Let me do your social media. Let me do your branding." We're like, "Okay, fine. Now we have to, be out there." So all of it was really the volunteers that want to help the people of Gaza. We're blessed and honored to have planted the seeds, and we're only at a small ounce. We haven't really done much. I mean,
can you mention how many patients you've seen?
we've evaluated just about over 3,000 patients.
I was about to say 300.
Even 300. Wallahi, for me, wallahi, if you were to get 10,000 volunteers, okay, and organize them just to help one patient in Gaza, I swear to you, it would be worth it, and this job will be fulfilled, and we wouldn't. Khalas, we're done with the organization. Wallahi. So we don't look at the numbers, but we've helped a little bit of like 3,100 patients. We've brought medicine in for 580 plus patients.
MashaAllah.
For a 3-month supply.
Yeah.
So.
And the game plan, like what Abdullah said, is that this is not a 3-month thing. It's not a 4-month thing. This is a 10, 20-year vision, because we realize now that the Gaza is decimated. There is nothing left in northern Gaza. The south of Gaza is likely to follow that, unfortunately.
Yeah.
Wherever the Gazans end up, they're going to need support for 10 to 20 years at least. These people, the people that have, and people like to throw out the number 30,000 dead, 40,000 dead. What about the 200,000 people that are missing legs and missing arms and
They're maimed.
are traumatized, they're maimed? These people are now requiring 2 to 3 people each just to take care of them. So this is something we need to build for the long run so that we from the outside can help the people on the ground.
I think one of the biggest things that is going to show fruitful much later is that the amount of documentation that Gaza Health has. A lot of the times when the IDF comes in and they go through the hospitals or whatever, they're destroying everything.
Right.
There's medical records, there's medical notes. All the stuff is documentation of what these doctors were seeing. So unless someone took something with them, then you're left with whatever was on social media and firsthand accounts. But now you have all of this documentation, all of these doctors treating these patients. You have WhatsApp messages, you have pictures. Assuming as you guys get more sophisticated, all this digitized information is going to exist as a proof against the oppressors.
Exactly.
Right? This is the consequence of what's going on in the ground. You guys are quiet. This is the consequence, right? And I think you guys mentioned that the genocide case against Israel, they use some of the data.
We said they should.
Oh, they should.
Yeah.
No, they definitely, yes, because guess what? This is data that's available this side of the this side of, right? It's very hard. I mean, it's very hard to get stuff into Gaza. It's very hard to get stuff out of Gaza. One of those things being these records.
Exactly.
Right.
And this is just another data. I mean, you have the videos, man.
Yeah.
Like, how much more clear can it be that there is, healthcare negligence and oppression? But now we have a different form of data. We have written documentation by the actual patients themselves.
Exactly.
And I think if we go back retrospectively and look at like when patients spike and what happens in the news, you probably match that up with like sometimes there's a giant attack and we go silent. We hear nothing from patients for a few days.
Yeah.
And then
exactly.
Then like maybe 3 weeks ago, we had 300 patients in one weekend. Like the app was just blowing up all day. So
the videos are important, but there are evil people out there that will figure
Hollywood, they call it.
Yeah, they call it Pallywood. Oh, this is fake. This is. But the thing is, when you have a doctor, like an expert who's looking at something and they're saying this is real, that you cut off that whole line of reasoning. Oh, this is fake. Like no, you had okay, where's your doctor? Do you have a doctor 100%. That's going to evaluate this? No, they're not.
It's funny, even Piers Morgan, our beloved Piers Morgan. Hope he hears this. But there's been like 2 or 3 doctors that have gone on his show that have been in Gaza that have been on the ground. And he takes their story seriously. It's like, hey, there's no nonsense, terrorism, BS, whatever. These people are there. They're risking their lives going there. And they are providing this aid. And while we're not risking our lives here, we're putting ourselves out there to try and do this for the people of Gaza. And this is documentation that will sometime stand the test of time.
Inshallah. I think this is a beautiful note to end it on unless something else you guys want to add.
Yeah, now it's just great. Whoever goes over to Gaza from our friends, they take our medications in,
and the fundraiser is still running, correct? On GoFundMe.
So unfortunately, right now, because the IDF took the border, where we've purchased meds and we're not able to bring anything.
You're not able to bring anything in.
We're not able to bring anything in, and right now our patient, load is also dwindling because people in Gaza are they're being displaced, they're anxious, and so. This is just ups and downs. This is the nature of such project organization. But we want to emphasize a point that the long-term vision is how can we use technology to provide medical aid to a humanitarian crisis all across the world. So now we're thinking about we're planting a seed for a new type of model for NGOs, in that you can reach patients with extremely low connectivity and still provide aid somehow, build a network for them to build, to get that aid. And that's extremely important. No patient, no matter what affiliation they have, no matter their political party, their religious beliefs, nothing matters when it comes to medicine besides making sure that patient is treated. And that's a human responsibility. For everybody. So we hope this idea, if not from us, from Gaza Health, that we have people in Sudan, in Yemen, in Syria, in Lebanon and all the war torn
Libya,
countries.
Afghanistan.
You know,
The ones you hear on the dua list in Taraweeh.
Yeah.
The
So-
endless dua list that gets longer every year.
you know.
Yeah,
So
unfortunately.
are you gonna in a danger zone? Are you gonna deploy doctors overnight to go into an unfamiliar territory that has? So this is the point of telehealth, like to also provide a supplement, not to replace, but to provide that supplement to serve patients that have lost connection. Where are you?
Yeah.
We're all you got to do is sign up, and we'll find you. We'll take care of you
MashaAllah.
as best as we can. You know.
I think you guys have done a great job with the resources given. Phenomenal job, especially building this completely from scratch. May Allah subhanahu wa ta'ala increase you and keep your intentions pure.
I mean,
And may He alleviate the people of Gaza from their oppressors. And with that, this is Amr Mabruk with the Prophetic Mentality Podcast signing off. Assalamu alaikum.